Hi, my name's Katie. I'm going to be your student nurse today, and we're going to be performing a physical assessment. Have you ever had one of these done before?
Yes.
All right. Can you give me your name and date of birth?
Robert Daugherty, 06/22/1997.
And do you have any allergies?
Nope.
All right. Can you tell me where you're at today?
Massimo.
And can you tell me which day it is?
Monday.
And can you tell me who the president is?
Trump.
All right. Patient is oriented to person, place, and time. I'm going to get started with taking a couple vital signs. I've washed my hands before I've touched my patient. Now on a scale of 0 to 10, with 10 being the most excruciating pain you've ever felt in your life, can you tell me if you're in any pain today?
0.
Okay. I'm going to start out with blood pressure. Patient's blood pressure is 128/82. All right, I'm going to take your pulse. All right, patient's heart rate is 82 beats per minute, and respiratory rate was 17 breaths per minute. The patient's skin is dry and intact. It is tan in color. His skin turgor is good and no signs of tinting. His capillary refill is less than 3 seconds. Okay, now that we're done with those, I'm going to wash my hands and I'm going to put some clean gloves on. And if you don't care, do you care to remove your hat? Because I'm going to start in your head. Okay, I'm going to start off by checking the patient's scalp. The scalp is white. There appears to be no lesions, and his hair is dark brown in color. His ears seem to be symmetrical, and there's no signs of lesions or any bruising or any drainage of any sort. His face also looks symmetrical and well approximated. I'm going to touch your face around your sinuses and let me know if there's any tenderness or pain. Any tenderness or pain?
Nope.
Alright, and I'm going to go ahead and check for your temporal pulses. Temporal pulses are 3+. Alright, I'm going to go ahead and take off my gloves here and wash my hands again. I'm going to get started with your eyes. His eyelashes seem to be well fanned out. His eyes look symmetrical as well and well approximated. I'm going to ask you to look straight forward behind me. And his pupils are equal, round, and reactive to light accommodation. His pupils are about 3 millimeters in size, and they are also symmetrical. Can you look here at this for me and follow it? Okay, patient's cranial nerves 3, 4, and 6 are intact. Oh, I still need this. All right, his nose seems to be well symmetrical as well. I'm going to look up here in your ears. His mucous membranes seem to be dry, or not dry, they seem to be moist and pink. His septum is intact as well. Can you cover one nostril and breathe in for me? And can you do it to the other? Both nares seem to be patent. I'm going to have you close your eyes real quick. And I'm going to have you smell something, and you let me know what the smell of it is. You got the wrong.
I don't know what that is. What is it?
Alcohol pad. Okay, you can smell it.
Yeah.
Okay. So patient's cranial nerve 1 is somewhat intact. Okay, now I'm going to assess your buccal membranes. Can you say "ah" for me? Okay, patient's buccal membranes seem to be moist as well and pink in color. His tongue doesn't have any lesions or anything on it. He has all 32 teeth. His tonsils were 2+. Can you stick out your tongue for me? And can you move side to side? And can you swallow? Okay. Patient's cranial nerves 9, 10, and 12 are intact. All right. Where we go next? I think I am all done here. Actually, can you smile for me? Can you raise your eyebrows for me? And can you puff out your cheeks for me? All right. Patient's cranial nerves 7 are also intact. Okay, I'm going to wash my hands again, and I'm going to check your neck. I'm first going to feel your trachea here. Can you swallow for me? Okay. There is no protrusions whenever he swallows. There is no signs of neck vein distension or anything going on there. I'm going to check both of your arteries or your pulses here, and both seem to be 3+. Do you care to look up for me? Look back down for me. Look to the side for me. Look to the other side for me. All range of motion of the neck are fine. Can you do this to your head? and all of his range of motion in his head seem to be okay. All right, can you shrug your shoulders for me? And can you roll them back like this? All range of motion there seems to be fine. I'm going to stick out my hands like this. Can you put yours underneath mine? And push up. And push down. Okay. All of the strengths there seem to be 5+. Can you squeeze my hands for me? That's also 5+, and I'm also going to check your pulses here. This is his radial pulse. It seems to be 3+, and then his brachial pulse, it also seems to be 3+. And can you full range of motion of the elbow, and can you do this to your wrist, and full range of motion of the wrist, and I would check both of those bilaterally. I'm going to stick my passy in my daughter's mouth really fast. Hey, hold on a second. Where'd it go? Here we go. Okay. All right, I'm going to wash my hands, and we are ready to move on, I think. So if you don't care to, actually, you know what? We're going to move on to chest sounds first. If you don't care to sit up a little bit for me. I'm going to listen to your breath sounds. One, 2, 3, 4, 5, 5. All right, and if you don't care to turn this way for me, like turn your, yep, and I'm going to listen to the lung sounds back here. Got 1, 2, 3, 4, 5, 6, 7, 8, 9, and 9. Okay, I'm going to have you stay with your back like that so far. There is no adventitious breath sounds. Now I'm going to check for chest expansion. If you don't care, I'm going to have you take a deep breath in and out. All right, chest expansion seems to be normal bilaterally. His chest is also symmetrical and has a 2-to-1 ratio, so there's no barrel chest going on or anything. Now while I'm back here, I'm going to whisper I'm going to whisper 2 words, and I'm going to need you to say those back for me if you don't care, okay?
Mm-hmm.
Okay.
Nursing school?
All right, great, thank you. All right, you can go ahead and turn around. All right, now that I've listened to those sounds, I'm going to listen to your heart sounds too. So let's get started on those. To find the heart sound, different heart sound, I'm going to find the sternum, the middle of the sternum, and I'm going to find the middle of the clavicle and then the sternum also. To the right of the clavicle and 2 down, I'm going to listen to the aortic sound. And to the left down 2, I'm going to listen to the pulmonic sound. 3 down, I'm going to listen to herbs. 4 down, I'm going to listen to tricuspid. And then 5 down, I'm going to listen to apical pulse. And I'm going to listen to that apical pulse for a whole minute. Actually, I'm going to first put a passy in my mouth before I listen to that. I would wash my hands, of course, and I'm going to get started. Alright, apical pulse was 92 beats per minute. I heard no heart murmurs or anything going on in the heart, so all looks well there. Okay, now that I've done all that, I'm going to wash my hands again because you can wash your hands enough times. There we go. Wash them again now that I've touched something else. Now that I've done all of that, I'm going to move down to your bowel sounds, so I'm going to have you lay down if you don't care. Alright, going to wash my hands. When was your last bowel movement?
2 to 3 hours ago.
Okay, and have you had any problems urinating or avoiding at all?
Nope.
Recently? Okay. The abdomen seems to be flat and not distended. And now I'm going to listen to the bowel sounds. Okay, I'm going to start in the right lower quadrant, the right upper, the left upper, and the right lower, or left lower. There are active bowel sounds in all 4 quadrants. If there were absent bowel sounds, I would make sure to listen to those for at least 5 minutes before documenting that they were absent. Okay, now I'm going to move on to your legs and your feet. Wash my hands one more time. And let's put on some gloves again. So his legs seem to be symmetrical and even in length. I guess that's what symmetrical means. I don't know why I said that again. seems to be no edema noted. I'm going to check the toes for any lesions. All seems to be okay there. I'm going to check the posterior tibial pulse. That is 3+ and palpable. And the dorsal pedis pulse. That is 3+ and palpable. If you don't care to, I'm going to put my hands at the bottom of your feet and try to push. Okay. And push there. Both of those strengths are 5. Okay, and now I'm going to take off my gloves and wash my hands. Do you care to stand up for me? Alright, if you don't care to, stick your foot out like this and twirl your ankle like this. And then put your knee up. And then put it up to the side. Alright, range of motion in the legs seem to be good also. And this concludes my physical assessment, and I would document all my findings.